Hi, I'm Anthony Visco. I'm the Division Chief of Urogynecology at Duke. Yeah, I grew up, my dad was a pediatrician in our house, so he saw patients in our house. I'd go over and see patients with him, and it just became a very natural part of my upbringing. So I liked helping patients, which is kind of a little bit of a cliche, but it was kind of how I grew up, and that's kind of why I went into it. And I ended up doing OBGYN and just loving it. Just delivering babies was fantastic, and I knew that this was what I wanted to go into. And then once I started doing it, I was taking care of patients with pelvic floor disorders and basically kind of getting their lives back, as many of them would describe it to me, and it just kind of motivated me and kind of inspired me to go into this field. So when a patient has some of these problems, it's often very difficult to find somebody to talk to. They're often embarrassed by it. It's just difficult to have this sort of conversation. You don't sometimes have this conversation with your friends and at a dinner or something. And so our goal is to set up a practice that from when they make their first appointment to when they come in and are greeted by our front desk staff, get a history from our nurses, and see any of our physicians, they should have a comfort level to kind of really explain to them, to the providers, what's going on, and be as open and honest as possible so that we can help them. We've been really advancing minimally invasive options for patients with pelvic floor disorders. In the old days, which unfortunately was even when I was training, patients were in the hospital overnight, sometimes up to 3 or 4 nights. And now we're able to provide highly effective surgeries through small incisions and get the patients home oftentimes the same day. The nice thing about all the fellowship trained faculty that we have here is that we all do the various surgical components of urogynecology. So we're not just vaginal surgeons or just robotic surgeons. And we can tailor what is most appropriate to that particular patient rather than just having one approach that we use in everyone.